So thank you for the invitation. I think Declan and Sandra sent it to me. And I think I was here 5 years ago, so every 5 years you have to put up with me for a few minutes maybe. I'm going to continue the discussion on PPI. I must say I'm not used to talking to people anymore. I'm used to sitting in front of my desk with my headphones on, a pair of shorts and a t-shirt. I've had to get considerably more dressed up to speak this morning, so put up with me as I sort of go through my slide deck. I have some disclosures I just want you all to know about, because I'm going to be talking about some of these studies, and you should know that I have some sort of involvement with them. But here is a case of abject failure on my part in 2010. We published a guidance on how to develop reporting guidelines, and we had lots of stakeholders, methodologists, statisticians, journal editors, who you should always walk at least 6 feet behind, and clinical trialists. But we didn't have patients. I was very bad, and our whole team was very bad about thinking about patients in 2010. But this might explain why an audit of approximately 260 reporting guidelines indicated that a very small percent of reporting guidelines included PPI. So that is unfortunate, but things are changing and moving in the right direction. I know Dr. Trico was here earlier this year, and I think she made a very wonderful statement that when patients lead, research is relevant, and I think that's, of course, very, very true. We've also seen the development of patient engagement in preclinical research, which I think is really important because I think most of you who are involved in preclinical research will know that the vast majority of it fails. And maybe one of the reasons that it fails is it doesn't have PPI involvement to sort of ask relevant questions. So we continue to see patients and the public involved in various aspects of reporting guidelines. So you might be asking, well, how will you get patients involved? For me, locally, and it's obviously going to vary for people wherever they're stationed, I just sort of send an email to our local team of patient engagement facilitators, researchers, and they give me lots of advice about how to involve patients in various types of studies, including in developing reporting guidelines. For those of you at centers where there's not a lot of information, you can go to sites like the Spore Evidence Alliance, where there's lots of tools and guidance available, including how to involve and engage patients in various aspects of research, including reporting guidelines. If you're thinking about engagement of patients or the public in a reporting guidelines, sort of what do you want to try to do? And I think one really needs to think beyond tokenism. I often hear people emailing me, asking me, is it okay to include a patient in a reporting guideline? And I tend to think that is very tokenism. And you obviously can't ask a single patient or member of the public to represent the broader society. So I think it's not particularly evidence-based, but we generally recommend people include 3 to 6 patients on any panel for developing reporting guidelines. And I think you obviously want a diversity of patients in developing a reporting guideline. I don't know what they call it in Ireland, but in Canada we call it equity, diversity, inclusiveness, and accessibility. And I think you want to make sure that patients have a real voice, that they feel that they may not have a PhD, an MD, etc. They're partners. And just because some of us have degrees doesn't make us any more fancy or otherwise. And I think one needs to remember that when you're onboarding patients or the public for reporting guideline, you've got to go through an appropriate process. You can't put them in a room and expect them to feel comfortable. There's a process to involve patients and the public. And at least in Canada, and I don't know the situation in Ireland, anytime we involve patients in the public, we have to pay them. And the Canadian Institutes of Health Research have a remuneration sort of policy, and they also provide facts and figures about what rates are. So at least it's really important to do that, and if you're applying for funding, you need to make sure that you've got those budget line items. What I hear sort of reporting guideline developers less interested in is issues around the objectivity of patients. In our part of the world, some patients are paid by activist groups. They're not particularly objective, and some of them do definitely have conflicts of interest, and you need to try to tease those out before you onboard any patient or public members. And you need to find out whether they're paid by different sorts of organizations. That's incredibly important to know for all research, but I think that you really need to know that for reporting guideline development as well. I'm going to give you an example of what I think is a fairly mature patient engagement process that we've used in a recently completed reporting guideline, PRISMA-COSMIN, which is for outcome measurement instruments, which unfortunately some trials don't pay enough attention to. So at the project launch, we have made a patient partner lead. We have somebody who's leading on that. And they're very involved in the whole launch of the program. We have an onboarding for the PPIs, and we express our commitment to why include them. So we want to make sure we're getting beyond sort of tokenism and just being able to say we include patients or the public. We include patients and the public in terms of the Delphi process that we've done for PRISMA-COSMIN. We have obviously an advisory role in work group meetings that patients are participating in and leading. They're highly involved in the drafting of the guideline, and importantly, they provide knowledge translation, and they're importantly co-authors on any publication. And now, I think it's important to also note that we're just wrapping up Consort 2023, and we will introduce an item on Consort 2023. Item number 8 will be PPI. And we're asking authors to tell us in reports of trials to detail the patient and public involvement in the design, conduct, and reporting of the trial. In the Consort explanation and elaboration document, we provide some examples. I've given you one here today of how patients are sort of embedded in a particular trial, and then we provide some explanation in the form of evidence. What is the evidence of involving patients in a particular trial, and how might they improve various aspects of a trial? And so that is integrated in the Consort 2023 E&E. I next want to move towards issues of reporting. And we asked editors-in-chief, approximately 100 of them, what's their view on having patients as co-authors. And I just want to share with you 3 results that I think are important to note. The first question here is, in your view, is it appropriate for patient partners to be authors or co-authors? And of the 107 editors-in-chief who responded, about 2/3 said, yes, it's important. But we still have some work to do to convince the other third. and hopefully we can make some implementation gains here over time. Another question I wanted to share with you is, should patients have to have an academic affiliation to be authors or co-authors? And nicely, we see that editors-in-chief, by and large, indicate that that's not the case. They don't need an academic affiliation. And the final question I wanted to share with you is, in your view, do you think that the ICMA-JE, which is the International Committee of Medical Journal Editors, whether that authorship criteria should be revised? And we see a lot of editors-in-chief sitting on the fence here. So we, again, have our work cut out to make editors more aware of the contributions that PPI make towards reporting guidelines. I wanted to end with some information. I don't know how many of you are aware with the top guidance, which is about sort of transparency and openness in research. And it's really important for reporting guidelines. It's important that if you're doing a trial, you transparently and completely report it. The top guidance were produced in 2015, and I think there's probably about 5,000 journals that have endorsed it. And if you look at this, even if it's in relatively small print, what you can see is reporting guidelines are missing. The team made a mistake of inviting me to the advisory board, and now what we see is top, which is being revised currently, will be adding reporting guidelines to the top criteria. And also, I think it's helping fill some implementation gaps that we see there. So I'm obviously not going to read all of this to you, but this is in terms of instructions to authors that journals will be asking prospective authors. Level 1 is simply to disclose it, and we're asking authors in the formal manuscript letter, if people are still doing formal manuscript letters, to indicate that you have used a particular reporting guideline to report your research, or in the sort of the manuscript submission platforms such as Scholar One, that would be a check mark box that the author would simply click. And if the author didn't click it and the letter wasn't there, then the author wouldn't be able to proceed along. And so we're trying to fill this implementation gap beyond asking people to disclose some information. We're actually asking prospective authors to do it. And then we're asking authors to certify that a reporting guideline has been used. Why are we doing this? Because there is randomized trial evidence that the use of reporting guidelines improves the quality of reporting of biomedical research. So I want to thank all the PPIs for enriching our research experience, and hope that over the 13 years since the 2010 paper, we've made some developments. So thank you.